Comcast Sportsnet Studios, this is Sports Night, brought to you by Wachovia.
To the frozen pond we go. Flyers winger Simon Gagne was sidelined 3 months ago following his third concussion in 4 months' time. And because the Flyers were knocked out of the Stanley Cup playoffs, it will be another 4 months before he's back skating competitively. Now, time is the best medicine for concussions, but as Delanham explains, Gagne is finding prolotherapy is helping him heal as well.
Still feel when you push on that.
Yeah, it's right there.
Yeah.
Mm-hmm.
Simon Gagne finding Dr. Scott Greenberg was strictly a coincidence.
One night I was watching TV with my wife, and now Dr. Greenberg came up on TV with the title was injection takeoff migraine.
Because Gagne was experiencing headaches after suffering his third concussion of the season, Greenberg's solution for migraines seemed a viable option. Earlier in his career, Gagne had twice had a concussion, but these symptoms were different, and he would soon learn Greenberg's treatments were different as well.
I basically specialize in doing reconstructive injections and reconstructive sports medicine techniques without surgery. Is basically what I've dedicated my career to help people, whether they have chronic back pain for 25 years or chronic neck pain or headaches, or we take care of a lot of athletes.
Greenberg felt Simon had suffered damage to his neck that was interfering with the nerve flow to his brain. After 2 injections, Simon felt significantly better.
The best person to know if it's working, it's me, and I feel my neck a lot looser, and headaches are gone.
Are you strictly judging if it's working by the person's word?
Well, no, because I judge how it's working based upon my examination, because I can actually feel the structure of the tissues and where the position is of them, and feel for the strength and integrity of the tissues, and that's what I'm basing it upon. This is a little tender, right, Simone?
Yeah.
But this is not tender.
On this particular visit, Simon feels pretty good, though there is one area of concern. It is a very specific, small area behind the right ear that Greenberg addresses with amazing precision.
That's it. Okay. You all right?
Mm-hmm. The last time I feel that hitting something, I feel like a little harder, and you could hear the needle inside of your neck.
Do you think your best playing days are behind you or in front of you?
You know what? I think that the best time for a hockey player are in front of me right now. I'm 28, and from 28 to maybe 30, 33 years old, it might be the best. I like to call it the prime of your career.
Just because something's not well known and not in the mainstream doesn't necessarily mean that it's ineffective, when in fact it happens to be a highly effective procedure. It just, unfortunately, there's such a small specialty of physicians that perform it properly.
When Gagne returns to the ice this fall, how he performs will go a long way in supporting Dr. Greenberg's beliefs. Dee Lynham, Comcast Sportsnet.
Now, Scott Greenberg's first patient was actually himself. After being hit by a drunken driver, Greenberg sought numerous doctors to treat his own back pain and headaches. Now, when nothing worked, he educated himself on regenerative medicine. Today, Greenberg plays recreational hockey and bikes regularly and never needing anything other than a Tylenol for his pain.